So the next question I have for you is about the rhinoplasty and really preserving the ethnic integrity of your subjects. That's pretty new, right?
Yeah, I mean, if you look at the nose jobs or rhinoplasties that were performed in the 80s and 90s, you could clearly see that, you know, the aesthetic concepts of beauty were completely destroyed. Because beauty is really, you got to look at every person with their facial features, skeletal structure, ethnic appearance, gender, height. There's so many factors that go into it. It's not a cookie cutter operation where you put this nose on someone's face and it looks great. A beautiful nose on one person may be really unattractive on another person. And that's the concept, I think, that's really important, and especially in the ethnic African American community, because the nose, I have this concept that you have to keep it within 1 or 2 standard deviations from the norm. So if the normal nose is this, you can't go too far outside of that norm. Then you create an unnatural look. And an unnatural nose is just as bad as having a big nose or a bump or a fat tip, whatever it is that people, you know, don't like. So that preservation of ethnicity is really, really important with the nose. And it takes a lot of, it's not just skills, it's really the eye of the surgeon and discussion that they have with the patient in, you know, in deciding what needs to be done. Because there are some patients that they just don't know what to expect, and it's really the surgeon's job to explain to them that these are the important factors. So making a nose really, really thin, or making the nostrils really, really narrow, or not doing the nostrils very well, not thinking about keloiding and so forth. All those other features are very important. Those are the key concepts of creating a nose that looks beautiful and perfect on that person.
Right. I mean,